It's a new day in modern dentistry. You can feel like yourself again with Shatkin Mini Dental Implants. Mini dental implants are the safe, fast, and cost-effective solution to many dental issues. Do you suffer with loose dentures? Are you afraid to smile or unable to eat the foods you love because you have missing or broken teeth? Mini dental implants are your affordable solution.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We're talking about the mini dental implant, a procedure that will change your life. And here to talk about it, I'm welcoming Dr. Lilian Jaime from Sunshine Dental.
Thank you, John, for having me here.
It's an honor to welcome you to Innovations in Health. We're talking about the mini dental implant, a procedure that will change your life. You can be you again. Folks, if you are in Albuquerque, Rio Rancho, North Valley, South Valley, Santa Fe, anywhere you're watching this television show, you can be you again with the mini dental implant. It's 5 times less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. You can change your look. It's an affordable solution. We'll talk about how Dr. Jaime and her team will help make this work for you. Folks, we love the food here in Albuquerque, New Mexico. The red and the green chili, when it's together, it's Christmas. A burrito, or imagine digging into a juicy steak or biting into a crunchy apple without fear of your dentures falling out. Dr. Jaime, we'll get to know you in just a little bit, but let's talk about the mini versus the conventional implant.
Absolutely. Well, John, mini implants, basically, the difference between them and conventional implants is that the mini implants are small diameter implants. So the hole that we create, if you can see it in the camera, is a very small in comparison to the conventional implant is the bigger hole that you see in the jaw here. The other difference is that we don't need to place any kind of bone graft that will go around that implant to hold it in place. We don't have to wait for 4 to 6 months for the implant to stay in place. And the mini implant is just a small little one that goes into that little hole and is one piece. So the root surface and the top surface is one part.
And in some cases with the mini, it could be a same-day procedure in your office.
Absolutely. And because it's the hole is smaller, we can fix that tooth right away. So there is no that long period of time of waiting for the restoration to come back. It's an amazing procedure that can really change the life of a person.
Change your life. So there's the difference between a conventional and a mini. Now let's talk about a denture. The lower denture, if you have one and it's swimming around in the bottom of your gums or you use that goopy adhesive, the mini dental implant will secure your lower denture. This is amazing. Dr. Jaime, show us what it is all about.
One of the problems I have with most of my patients is that when they wear a denture, they can keep it in place, especially the lower. It's the hardest one to hold on. Why? Because the tongue goes in the bottom and every time you want to eat, the denture is just coming out. So what that mini implants will do is going to give that stability that the denture will need in order to stay in place. So you can be confident again, you can be able to chew again, you can eat your food, and your life will be completely different.
And most importantly, that adhesive, that goop is gone, Dr. Jaime.
Absolutely. You don't know how many times my patients say, Dr. Jaime, we're so tired of being wearing this, using this cream. And not just that, the bone keeps shrinking. So the longer you keep this denture in place, that goop will not work any longer.
Won't work.
So definitely you need to have something to help you stabilize the denture. And these implants are one of the best solutions for patients with a need of stabilization of the dentures.
If you have a lower denture, odds are you probably have an upper denture. As we mentioned earlier in the program, you want to enjoy all the great foods that we love in New Mexico. The palate is exposed with the mini dental implant upper denture example. Show us the difference.
One of the problems that a lot of people have with their upper denture is, one is kind of difficult to talk. The other one, it can be that they cannot taste their food. If you can see with this one, this denture right here, you have this space, and this space is where the palate goes. When we place that denture in place in here, But you can see now the palate is not covered anymore. The taste buds are in there, and they are really necessary for you to be able to feel and taste the green chili and the red chili.
And the breakfast burritos and everything we love. Yeah. And, the official state cookie with the anise flavor.
Absolutely, and that's the fun part of life.
Yeah. Show us, Doc, how that upper denture example looks so beautiful.
The part that is beautiful about this denture is the fact that you don't have, the palate is uncovered. Your conventional dentures, usually they have the palate is all covered and it's hard to talk or taste your food is kind of different. But with the mini implants and here in place, we give you the stability and we'll give you the support that you need, and the best part that you can taste your food again.
And your speech is better because you're not covering your mouth with all of that plastic.
Absolutely, and that's the best part of having a denture that is stabilized with implants.
As we move on from dentures, ladies and gentlemen, the mini dental implant procedure can also offer you what really appears to be and is a full set of teeth, either an upper or a lower, with what we call the fixed on 6. Dr. Jaime is going to show us.
The same kind of situation when you don't have no teeth on the upper and you want to upgrade your denture that is not over the implants, you can do another appliance that calls Fix on 6. And this is like teeth that are coming out of your gums.
What is that made of, doctor?
This is made of zirconia. It's a very strong material, so you can chew, you can eat. The best part too is also is not covering the palate. So if you can see, it doesn't have any pink area. So you can smile and it looks as close as can be as your natural teeth.
Yeah, and it's something that you can do the upper or the lower or both.
Absolutely.
And the caring for the mini dental implant with the fixed on 6 is really a visit to you every 6 months or so.
Every 6 months, and all you had to do is come in and we remove your appliance. We don't want you to remove it at home. We take it out for you and we clean the implants in there. We put it back in place and you go back home. We'll see you back in 6 months.
They look beautiful. And folks, if God gave us our baby teeth and our adult teeth, Dr. Lilian Jaime from Sunshine Dental is about to give us our 3rd set of teeth with a more permanent solution called the roundhouse. Let's take a look at this example.
And this is very similar to the other one, but with the difference is that we place more implants in here. And if we had the bone available, we put between 10 to 12 implants in here. And this is that permanent solution for the mini implants, where it will be the closest thing you can have of having your natural teeth. This is cemented, permanent into the implants. So no reason of taking out. You still come and visit me for the cleaning. You need to use your water pick, but this will stay in your mouth.
And that
permanent.
water pick is very important, isn't it, Doctor? Not only for whether you have a mini dental implant or not, but for general dental care, and I know you're a big advocate of the water pick.
Absolutely. I think everybody should use a water pick. The water pick can just flush everything out, any debris of anything they want to get around, and keep your gums healthy.
If you have teeth in the back of your mouth and you've neglected them, those are the teeth that are the workhorse teeth. They chew the food, they get all the nutrients out. But if you're neglecting them, your shape of your mouth might change. Or maybe you have a tooth that's fallen out in the front, or you have a problem. The mini dental implant will not only be a quick fix, it's a permanent fix, and it looks spectacular. Let's take a look, Doc.
Absolutely. And those are the cases that I see patients that they come because they fractured their tooth. They may have a very good teeth and something happened by playing basketball or any other trauma. And this is an easy solution. We place the implant, and in some cases we can actually do the crown at the same time, and it's permanent, cemented over the tooth.
And that's custom made.
It's custom made for that patient, and that tooth looks just identical like the other teeth around it.
And it doesn't matter the age of the patient. If it's a denture patient, you're a little older, you can live your best life as long as you live. If you're younger and you have that single tooth that's a problem, you need to get it fixed. But how about the teeth in the back?
If you're missing the back teeth, like in this case, in this model here, the whole section can be replaced by placing those mini implants in there. Then we customize again just to you to place a bridge that will look just exactly like the rest of the teeth, and we cement it permanent. And the patient can be able to chew, you can eat, you can taste your food. It doesn't have any plastic around, it doesn't cover anything of the palate, and is the closest thing that you can have like having your natural teeth.
Yeah, very important. Those teeth are very important, folks, because they are the ones that chew the food. And if you're favoring one side over another, it could create problems. Plus, your face gets sunken in if you don't have all the teeth there. So you want to look your best. Now, at Sunshine Dental, Dr. Lilian Jaime has some innovations in health, which is why we're here on Innovations in Health. And I know you wanted to show us something that you've created in your office for an actual patient.
Sometimes the patients may not be ready to have implants, and we need to pull the teeth and we need to wait for them to heal. There is this new kind of partial that we make. It's a special material that is very flexible and it doesn't put any pressure on the gums. And because we don't put no pressure on the gums, it's very comfortable. To be honest with you, most of my patients don't like partials because partials produce a lot of the gums hurt, they are uncomfortable, but I find out that this material is the best material if you have to wear a partial because maybe you are not capable to do the implants yet. The other good part is that even if we hold on in a couple of teeth of your natural teeth in there for some time, once the bone heals, we can place some implants in there and still wear the same partial over. Until transitional, later, at some point, we will end up with some more implants, and in that case will be a denture. But in the meantime, there is a process that we can help you before you get to that point.
And Dr. Jaime created this in her office at 10411 La Grima de Oro Road in Albuquerque. Now, if you have a transitional time in between maybe something that's cosmetic, your mini dental implant, your denture, Dr. Jaime has something that she's created in her office that will get you through, even if it's for several years while your dental work continues.
In cases where the patient have missing their front teeth again, and they are not ready to do any implants, or they want something that can be fixed right away, or they have a wedding, or they have a special occasion, and they want to have a beautiful smile right away, I designed this appliance, and in 2 weeks, I can give you back some teeth. These go over your natural teeth and you have a smile again.
And that's custom made. We should make mention of that for each patient.
Absolutely. This is custom made. I mean, to your face, to your lips, to your mouth, to your teeth around, and it gives you a way to wait until you are in a position where you can do something permanent. And this appliance can help you at least for around 3 years.
Dr. Lilian Jaime, she is a creator of many, many things, an innovator in health, and they are at Sunshine Dental, 10411 La Grima de Oro Road in Albuquerque, New Mexico. And we should mention, if you're near Montgomery and Morris, you know where that is, and Dion's Pizza is not too far away. So we all know that. And the area code is 505, the number 355-0019, and online at sunshinedentalnm.com. So you want to make that call to Sunshine Dental and Dr. Lilian Jaime. Dr. Jaime, let's talk a little bit about you. Where did you grow up?
In Honduras.
And you were in dental school back east. Tell us where.
I went to University of Pennsylvania.
And how did you get to New Mexico from Honduras and the University of Pennsylvania and now here to Albuquerque?
I saw my husband fall. I followed him.
Well, good for him that he's gotten you here to Albuquerque. How long have you been in practice at Sunshine Dental?
For 25 years.
Tell us about your family.
I got 4 young adults. I got 2 cats and 2 dogs.
And I understand that you play a musical instrument. What do you do?
I played piano, and I love classical music.
You've helped other people through your piano playing. Tell us the story of how you connect with some seniors.
Yes, I visit some senior centers and I help them, show them how to take care of their dentures, and after the end of the reunion I play piano for them for a couple of hours.
Oh, that's beautiful. I bet they love the dental work assistance and your beautiful music playing.
Yes, absolutely.
And you have such a passion for the patient, and we'll talk a little bit more about that as we move forward with our program, but you also have a passion for the people of Central America. What have you done in your missions of mercy?
I helped them and did a lot of extractions, at that time. I helped them with all their needs, their teeth, and I went with a different group of dentists and we saw a lot of patients, and I think we made a difference in that community.
And I know that you fly up to Buffalo, New York, and you connect with another dentist there, Dr. Todd Shatkin. What have you learned up there in Buffalo?
I learned that there was a better way to do an implants, a less invasive way, a way that you can make a whole big difference in the mouth of the patients without being very invasive.
And when you meet with your patients, is it a free consultation?
It is a free consultation, and it gives us an opportunity to see where you are, what are your needs, how can I be able to help you to create basically a piece of art in your mouth. And it gives me the opportunity to see where are the conditions and what are the alternative for treatments that I can present you.
And you have a piece of equipment called the cone beam that's a part of the consultation. Explain what the cone beam does for the patient that comes in for the very first time.
That cone beam is very helpful for me because it helped me to know how much bone is available and how many implants I can place and where can I place them. And it helped me to create that design of the treatment.
You are an artist. You mentioned that before, and we saw that in the explanation of the models. I know it's very important for you to connect with the patient on a very one-on-one way, more than most dentists do. That consultation is really getting to know the patient because each patient is individual.
Yes, every single mouth is very unique. God made us in a very, very special way. And I would like to know, where have you been? Where are your expectations? What is your desire? How can I help you to achieve those desires?
Well, we've looked on your website, and it's sunshinedentalnm.com. You'll notice that the Google reviews are all 5-star. And many of those folks that talk about their experience with you talk about that personal piece. You have so many before and after photos. Before we recorded the program, you were showing me what Dr. Jaime was maybe thousands of photos. And you had a story for every patient. But there are a few that are very memorable to you. And there was one gentleman who has since unfortunately passed away, but share his story because it's so poignant about how you helped change his life.
He came to visit me, and he came with a caregiver in a wheelchair, came with a very loose dentures. He wasn't able to eat. He was kind of very sad also, very malnutrition. And he gave me an opportunity to be able to fix his teeth, and we did one of these round house. We placed implants, we placed those teeth with a permanent way. A couple of months later, he came to visit me, and he was not in a wheelchair anymore. He was walking. He didn't have no more caregiver anymore, and he was so happy. He told me the story that at some point he was an alcoholic, and the reason was because he was so hopeless. His life was just didn't have no purpose anymore. And once his teeth were in place, he became a chef. He started eating the best food and creating the best cooking skills that he can get, and enjoy life again.
And you brought his life back for the remaining years. And there's another
Yes.
lady that you helped as well, and her story was fascinating too.
Well, for her, it was so much fear for her to come to the
A
dentist.
fear of coming to the dentist.
It was very fearful, and he let all her teeth to really get really bad damage. At some point, she had a dental floss that was holding the teeth in place for her because she was so afraid to come to the dentist. She came to see me, and we were able to help her out and give her this beautiful smile, beautiful teeth. We fixed this, placed those implants, and put a round house on the implants, and I gave her the smile back. And that was the confidence that she needed. And she was already a beautiful lady. It's just the teeth were not helping her. So giving her the teeth was, she started being shining again, being heard again.
Yeah, beautiful
Yes.
lady. And you know, there are so many before and afters that you've taken, and we'll show some of them as we're talking. You know, some very significant dental work that people need, and that process that was in place with you with all of these various patients, start to finish, you really gave them back their life. What does that mean to you, Doc, when you give somebody back that confidence? I know that's very emotional for you.
It is a satisfaction to know that I can be able to be part of serving them in a way that they can come back to life. Basically, to come back to life where now they can travel, they can eat, they can work. Sometimes losing the confidence, you cannot be yourself. So just being able to see all the changes on my patients is so satisfying for me.
Well, it's a beautiful experience that you create for them. And folks, if you don't believe us, let's hear from some patients who've experienced the mini dental implant procedure and how it's changed their life.
I knew about hygiene and taking care of yourself, but never did take too much time on my teeth. And I said, this is something I need. Overall, I felt very welcome here. It's a family-oriented, very friendly establishment. It's the treatment plan that Dr. Jaime gave me that I'm following that actually is helping me keep my teeth. I went to my physical therapist and she noticed them right away too. And she was like, wow, you look like a new man with those teeth.
My teeth situation has always been kind of marginal, and I decided it was time to upgrade. So I know a lot of people think it's out of their budget and everything like that, but if you can't afford to pay cash, they work with you. They look so much better than what my natural teeth did, so I'm really happy with the whole thing.
I had gone through other consultations, and this is the one that I chose. I was very comfortable. It was such a happy, wonderful, joyous moment. I even cried. Even as I was driving, I was looking in the mirror, smiling and saying, she did it. I can eat a steak. I can bite an apple. I can eat corn on the cob. It's a blessing.
Great to hear from those patients, Doc, that you've helped. And I know that you help them make this an affordable experience. How do you work with the patient to make this work for them?
I have a treatment coordinator, and she presents different options to our patients. There are different finances company, like Care Credit is one, and she finds a way to help you, a way that you can afford this treatment.
So if you're watching from anywhere in Albuquerque, Santa Fe, and anywhere in between, if you have an issue, don't put it off. The longer you put off a dental problem, Dr. Jaime, it could make your problem worse.
That's one of the issues with your mouth. You don't have the time, because the more time you wait, the less bone you will have, and the harder way to restore it.
You mentioned when talking about one of your patients, the fear of the dentist, and there shouldn't be a fear. Maybe somebody had a childhood experience or a painful experience years ago, and that isn't the case anymore. It's a practically pain-free experience to go to the dentist now, isn't it?
Yes, I mean, we have so much technology. There are different ways, and the beauty about these mini implants is because they're so small. We don't have to, it is actually painless because the procedure is fast. We don't have to numb you a lot to do it, and most of the cases, John, I don't have to give my patients any pain medicine.
So if you're watching Innovations in Health and you just joined us, we're talking about the mini dental implants with Dr. Lilian Jaime from Sunshine Dental, 10411 La Grima de Oro Road in Albuquerque. If you've been with us for the whole half hour, you've met Dr. Jaime and you've gotten to know her and what an artist she is. We want to show you the models again, because if you have a lower denture and it's swimming around in the bottom of your gums, Dr. Jaime, show us how it remains in place.
Absolutely. This is for the lower denture. You get 4 mini implants in there, and that will help you and give you some stability of your denture.
Now, odds are if you have a lower, you have an upper denture, but we love our foods here in New Mexico, and now you can do that without fear of your denture falling out, and the taste sensation is back, Dr. Jaime shows us.
This is your upper denture. So now you don't have no palate in there, and your palate is free to be able to taste your food one more time again.
And if you have a full set of teeth that you need, the fixed on 6 could be the answer.
And this is similar to the one with the denture, but it's more upgraded. Now you have a ceramic crowns that go over those implants, and the best part is that this will stay in place, and it looks like that teeth are coming from the gums, so no more plastic around it.
Now, if you need a permanent solution, God gave us our baby teeth and adult teeth, Dr. Lilian Jaime is going to give us a third set with the roundhouse.
And with the roundhouse, the best part is that this is going to be permanent, and is the closest thing it can be like your natural teeth.
Now, if you have teeth that are in the back of your mouth and you're saying, well, it's out of sight, out of mind, I'm not going to worry about it, you shouldn't. Dr. Jaime is going to show us how the mini dental implant will take care of the back teeth and also a single tooth that might have fallen out or have a problem.
If you're missing some teeth in there and you need to replace it, we'll place the implants and we cement just one section of the missing area and it won't come out. And if you're missing just one tooth, a single tooth, then we can just put one implant in there, will look similar or identical to the rest of your teeth, we cement it over and there you go, you have your tooth back.
And at Sunshine Dental, you have the opportunity to meet an innovator in health. Show us the difference in these models now, doctor, with the partial that you've created for one of your patients.
Yes, and that is if you're not able to do any implants at this point and you had to wait for some time for you to be able to do it or afford, or we have pulled the teeth and we had to wait for some healing, this kind of partial is a special partial that it will hold on and will be very comfortable. This is not like your regular partials. These are a special material that it holds around the teeth and it doesn't put any pressure over your gums.
And look at this transitional piece that she's created.
And this is, I call it a transitional smile. If you're missing your teeth and you're not able to do any implants at this point, don't worry about it. There is another option in here. We design your smile just for your teeth and we place it over your teeth. And this appliance can be good at least around for 3 years.
Dr. Jaime, it's very important to know that your practice is bilingual. Explain that.
Yes, I speak Spanish, and it's very important for patients, especially the ones that are afraid to have a dentist that speaks Spanish. Because a lot of times they come with their daughters, they speak English, but having the dentist to speak Spanish is a big difference. I just had a patient that came to visit me, came with the daughters, and she was so happy that I was able to speak Spanish so she can tell me all her symptoms and feel so confident, and she was hugging me, and she was just thrilled that I speak Spanish.
So if you could impart a message to our viewers in Spanish, what would you say?
I would say, bueno, yo estoy aquí, si me necesitan, yo les puedo ayudar en cualquier situación que tienen, especialmente si tienen dentaduras que no les pueden quedar muy bien, podemos poner implantes y darles la estabilidad y darles la confidencia que necesitan para poder sonreír.
I have to ask, what inspired you, or who inspired you, or what experience inspired you to become such a compassionate, caring dentist?
Well, John, I used to have a beautiful dog. Her name was Tosca. And
what kind of dog was Tosca?
Tosca was a Samoyed, and it was, she had a tooth sticking out, and every time I go with her for a walk, she smiled at me with that tooth out, and I said, one of these days I will pull the tooth. So I went one day to my parents' garage and pulled the pliers.
How old were you when you did this?
Around 15 years old. I went and I pulled the tooth on my dog, and I was like, oh, she was good with me. She didn't beat me, and so maybe I do have a talent in this. So that was my inspiration.
Dr. Lilian Jaime, you are an innovator in health, and everybody, you can go to see her at Sunshine Dental, 10411 La Grima de Oro Road in Albuquerque, New Mexico. The number to call, 505-355-0019, and online at sunshinedentalnm.com. Dr. Lilian Jaime, thanks for joining us on Innovations in Health.
Thank you very much, John.
Thank you, and thank you for watching.